So what I'd like to talk about today, a little bit about sort of what are the perceived issues. What's my kind of take on the perceived issues with respect to public sector IT procurement, and what's been the response from the government's perspective to these IT, quote, issues. I'd like to talk a little bit about, I thought the introduction with Suzanne and Gary was quite good about, the issue of rules and the RFPs. The issue is, has that pendulum swung too far? I think I would know if we took a vote what your vote would be, but talk a little bit about that. At the end too, kind of from my take on it, what can the vendor community do about this? And my sense is that's one of the issues you're going to be talking about today. So, I'd like to spend a couple of minutes about that. And as I said, time for a couple of questions at the end. Now, if I look at things, when I'm out doing audits, we do a lot of, when people think of an auditor, they typically think of somebody going out auditing the accounting records, auditing the books. The Ontario Auditor General's Office is a bit different. We only spend about maybe 30% of our time doing that. We spend about 70% of our time doing value for money audits, where we're going to be going out, we'll look at basically everything, every public service the government does, whether it's the operation of operating rooms in hospitals, whether it's constructing roads, whether it's major IT projects. We do a lot of work, and when we go out and do those audits, we typically don't even darken the door of the accounting office. So we're very much what we would call an operational audit office. We're a bit different than the other Auditor General offices, and the reason is that I report to the legislature. I have a standing committee that I meet with every week, and it's called the Standing Committee on Public Accounts. And over the last 10 years, they've probably met 150 times. They've had one meeting out of the 150 on public accounts on financial matters. They don't, I'll be honest, they don't have a lot of interest in that. They want to talk about healthcare, social services, mental health, IT procurement. That's what they're interested in, so that's where we focus our work. But anyway, going back from the public's perspective, I think when they look at technology, they think of, MRIs, and does technology allow me to get better health care? And I think the sense would be that technology is good. I get better health care because there's technology there. However, I think there's a real expectation out there that it be done cost effectively. And I mentioned the diabetes registry is just an example of when you get an IT project, major IT project in the government that gets canceled. It does get attention, and it does get reported. It's certainly discussed in the legislature. So I think IT, compared to a year ago, these big major IT projects, they are more visible than they were, say, a decade ago. I think from the government's perspective, if I was to talk to the people, and I'm over at the Ledge quite a bit and I talk to the people, I think they would say there's very few files from the Liberal government over the last 8 or 9 years that has had a big of impact on them as the whole e-health issue. But I'd have to say the government, the senior policy, the senior decision makers in government, they are very aware of the major IT, should I say, issues and projects, whether it's social services, the welfare area, whether it's in the justice area. And my sense is they're somewhat gun-shy of making these multi-million-dollar investments in IT. I get that sense. And I think one of the reasons is that in the government, I'll be honest, even in a large ministry, often when you're putting in these IT projects that cost tens and hundreds of millions of dollars, what we see when we go in is often they don't necessarily have the in-house resources to make sure that they can oversee the project management on a very sophisticated, technically complex project. And so it carries a fairly high degree of risk for them. And my sense is they're a bit gun-shy. How do we manage this? I remember 8 years ago when the Liberal government came in, not telling tales out of school, but they have a management board of cabinet which is comprised of about 6 or 7 ministers. And I think this was in the first couple of months, and they basically called me up and said, we'd just like you to come over because one of the issues that we're wrestling with, we've got these big IT projects. We don't know how to oversee them, Jim. We don't know really how to control them. We're worried about them getting out of hand. We need some help. So that was the feeling in the room of the Dwight Duncans and the senior government ministers that this was a high-risk area. we're not sure what the right answer is, how to control this thing. We're worried about a big blow. Auditor General, can you give us some tips? I think there is a recognition that IT can be a business enabler. I think Suzanne mentioned the word enabler. That's the word that I've always used when I think of IT. How can IT be used as an enabler to further your business or your healthcare objectives? I certainly think there's a recognition of that, but there's also a recognition that if we have a big blow and something doesn't work out, it could be on the front page of the paper. So what was the response to that? My take on that is I think the response has been rules and more rules. What are we going to do? Okay, we got to tighten up the rules here. I would agree. I think the comment was made. I think the RFPs are becoming increasingly demanding. I think that the government, and I think they've recognized this a little bit from the P3, the infrastructure. How can we allocate some of the risk to the vendors? Instead of us taking all the risk, how can we do it so that we can allocate the risk to the vendors? And I think there's a recognition of that. I think they would like to do more of that if they can. My sense would be that I think these days we've got a challenging fiscal environment. So, you know, I think like I'm talking major in the tens, maybe $100 million big projects, I think they're probably a tougher sell than they were 5 years ago or 10 years ago. I'd like to talk a little bit about e-health. When e-health came down, what we had said was that basically the rules for the most part governing IT procurement, to my sense, I mean, they weren't perfect, but I thought they were fairly reasonable. They were not bad rules. The issue was they just weren't followed. Government's reaction was, I think the Premier stood up and said, you know, we dropped the ball on this. We've concluded that not only were the rules not being followed, but we're convinced the rules were inadequate. So, as the government, we're going to fix it. And they tightened the rules up even more. They extended the rules into the broader public sector. 10 years ago, we've done work in consulting in different areas. The broader public sector, the big hospitals, which you probably deal with, they probably had more leeway. Now there's certainly more of an emphasis that you better toe the line when you're doing your competitive strategies. You better make sure that it's accountable, it's transparent. We expect you to adhere to good, open, transparent, competitive policies. The same would apply to what I would call some blow-ups too, whether it involved the Lottery Corporation with some of their travel expenses. What was the answer? We've got to tighten up the rules. That's been the response over the last few years. So as I said, RFP more stringent. I'm getting some feedback from the smaller vendors, and I think someone mentioned that this morning, that the feedback I've been getting from the smaller vendors is that some of the RFP requirements are getting so stringent we can't even bid anymore. And this comes from the consulting side as much as the IT vendor community, but I'm certainly getting that feedback. I noticed with interest your workshop agenda, which I thought kind of hit the nail on the head. I think that really summed up what the issue was. I mentioned too, with respect to the P3 on the risk sharing, what they're looking for is, you know, rather than us take the risk, we'd sure like to be able to pay for a completed deliverable problem. So if you have technical problems basically on the project, it's kind of like not my problem, quite frankly, because I don't necessarily always have the expertise to maybe knowledgeably oversee the project. I think they're getting better in that area, but there's certainly some organizations where they would be challenged to technically, knowledgeably oversee $100 million, and I'll be blunt, to make sure we're not getting taken to the cleaners. Use the word skin in the game. They want the vendor to have skin in the game, so that if something goes wrong, we're not the only ones that are going to lose. You're going to lose too. As I've said to the government, even if you go this route, it doesn't mean that you can sort of totally abdicate oversight. It might reduce it, but you still need a reasonable level of oversight. I think the vendor risk is that, you know, you go on, you basically say, okay, we're going to commit all the capital up front, we're going to develop your project. If we deliver a completed project, you're going to pay us $40 million at the end of the day. There's always that risk, especially in a political environment. What if the client walks away? the one thing we see all the time, and not just healthcare, social services, a lot of the big projects, is that they don't do a good enough job up front, really specifically defining the user needs. What would be the finished deliverable? And it was mentioned too. I used to teach IT up at York University. And, you know, this very specific RFP, I'm probably more of the mind, tell me what you want at the end of the day. What do you want the users to have to be able to make their decisions? And then let the vendor community figure out how to get there. That would be my view of the best solution. But my sense is they're not there yet. Certainly, I think in these tough fiscal times, things going through Policy and Priorities Board, going to Cabinet, going up through what's called an MB20 to get approval, I think things are becoming a tougher sell, as opposed to, say, 5 or 6 years ago when the province was, I don't want to say flush, but didn't have the fiscal challenges that it had now. The other thing, I think there's a recognition now when it comes to really new, innovative projects, we don't want to be on the bleeding edge, which is kind of the first one out the gate. You know, let somebody else take a shot and develop this first. Let some other, in Ontario, let some other jurisdiction do it first, and we don't mind being on the leading edge, but we're not going to be first out of the gate on the bleeding edge. It ties into our innovative IT strategies perceived as too risky from a risk-reward perspective. You know, what's the reward we get if we put in this? How's it going to help us get, to be blunt, how's it going to help us get reelected? As opposed to if the thing blows up, what's the impact going to be? What are we going to do? That's the thinking, I think, around the cabinet table and around the policymakers when they're making these big decisions. With respect to whether the pendulum swung too far, and by the pendulum I mean the rules. Have the rules gotten overly too prescriptive? Are the RFPs too tight? Are they demanding too much? I've heard the issue of the liability before, especially impacting small and medium-sized vendors. Where am I going to get insurance to provide this kind of coverage? I can't even bid anymore in some of these things. And I think I can provide a really cost-effective service. I'd have to say that because of the e-health, the $1 billion boon, and by the way, e-health wasn't $1 billion. They spent $1 billion, but I'd have to say, and I think I've said this in the press conference, that they didn't get value for money for maybe hundreds of millions of dollars, but certainly not $1 billion. But you know, the opposition, it's a catchy term. And it did get a lot of press, and because of that, I think the public is more aware of it. And when you see the media pick up something like, you know, the diabetes registry, the IT project got canceled, when you see the media picking up and reporting that, that would have been something 10 years ago. I don't think the media would have it would have been like just off the radar. But now I think there's more visibility to it, there's more of an awareness to it, and I think the opposition, and you have to be aware of this, I think the opposition is more aware of it. So if they hear about something blowing up, they're going to raise it in the House. All of a sudden the media lifts their head up and say, what's that all about? So there's more of a chance of it getting reported in the media. That gets out to the public. But, you know, you have an IT project and it goes very well. Do you ever see that in the newspaper? Good luck. New Treasury Board policies have been issued, and I mentioned that in the broader public sector. I'd say this is certainly an area where the government has clearly said to the broader public sector, you've got to basically follow the same rules that we follow. We don't want anything untoward going on out there. We want to make sure that it's transparent, it's accountable, it's competitive. And they basically almost mandated that, and they put that word out to the boards of directors of, say, hospitals and universities and colleges. So that flavor is percolating down to the broader public sector as well. And when I think about procurement rules too, you know, the purpose of having kind of rules and guidelines, it's to sort of help your people in the organization make the right business decision so they can further your business objectives. It's not having rules for the sake of rules. And that's why I worry a little bit. And you know what, I think they're videotaping this, so oh, there's the camera, I'll say it on record. I've been on TV and I've said this on, I think, Focus Ontario. I actually believe the pendulum has started to swing too far. And I think there's a risk that if it gets overly restrictive, it can get in the way of making the right, you know, business decision. And let me give you an example. I get, what's one that might be IT related? IV drips in a hospital. I get had a call a while ago from the president of a hospital. We'd been doing some work in another area. I think it was on maybe infectious diseases or something. I can't remember. He phoned me up and he said, you know what, Jim, I just want to bounce something off you. We've got IV drips, across the hospital. And they've got all these procurement rules right now. And we've got to start replacing these IV drips. But right now we've got, I don't know who the supplier was, let's say Becton Dickinson. We've got these all the way through the hospital. We want to replace them in a particular unit. Now, technically, I should probably be going out to tender. But I don't want to be in a situation, Jim, where all my nursing staff knows how to use the IVs across the hospital. They're interchangeable. I bring a new vendor in. I've got to train the nurses again. How do I get around that, Jim? And this is a fairly small unit. It probably exceeds, the purchase will probably exceed what the procurement rules say I should go out and tender. And CEO said, what should I do? And because I really think to follow procurement rules, I got to go out, and I know somebody's going to come in. They want our business. They're going to lowball bid it, and they're probably going to get in. I've got staffing, training problems. What should I do? I kind of sat back, and my sense was I thought in that situation, at the end of the day, I've always felt that common sense should prevail. I think common sense would be, two things. First of all, I'd probably buy the Becton Dickinson ones and put them in, but I think you need to have a formal policy where you can go to the vendor community and say, over the next 3 years or over the next 4 years, we're going to give everybody a chance to bid on the IVs for our hospital. And because the vendor community, it's only fair to the vendor community, they need to realize that I'm going to have a shot at this business at some point. And maybe you're doing this now, but I said the other thing I think you need to do as a CEO, I think you really need to go to your board of directors just because of the visibility of this. And the board of directors is on the hook now with the Ministry of Health to follow the policies. And I said, go to your board of directors, discuss it with them, make sure your board is on side before you go any further. But that's the sort of calls that I'm getting now where, you really do wonder where, are the rules getting overly restrictive, and at the end of the day, common sense should prevail. And actually, I've said this publicly as well. I do a press, we will issue an annual report every year. It gets a fair bit of attention. We usually table it in early December. And the media always likes to have a press conference with all the cameras and everything. And I always have an opening statement, and then there's 30 or 40 reporters, and they kind of barrage the poor auditor with a bunch of questions. But in my opening statements, I thought, I'm going to get this across about, this whole procurement area, because I know Dwight Duncan's gone now, but Dwight and I talked about this, about the procurement area, and I did say to him, Minister, I said, my sense is that this procurement might be getting too far the other way. And he said, well, I hear you, Jim, but, we got the rules in place now, and, how do we, and I sort of said to him, Minister, if you decide to do something about it and you want to stand up in the House and say, I've talked to the Auditor General about it, and the Auditor General feels what we're doing, it's reasonable. So I have kind of conveyed that message, but, my sense is that from a risk perspective, they just don't want to they're not taking any risks in this area. And it could be because of the e-health. They just say, I can't afford another e-health, and as soon as we do something, we're going to get the opposition standing up in the House, and they're going to say, you know what? You've loosened the rules to let all your buddies get all your business. And they don't want that situation in question, period. So as you can see here, I basically kind of said that, you've got to be very careful with these new rules, that they don't go so far as they inhibit what I would call common sense, sound decision-making, and, inhibit new entrants from easily competing for government business. And I do worry that the pendulum is starting to inch, I'd have to say, a bit too far in the other direction. So, and I did go out, I did say that publicly. What's going to happen, I don't know. But I think if you're concerned about the rules and the restrictiveness of the RFPs in Ontario, I think there could be, some validity to that. But by the same token, the most important thing is, what we've noticed on our audits is that the rules before, when I look at e-health and I look at lottery, I look at healthcare consultants in hospitals, usually what the biggest problem was, the rules just weren't being followed. What am I telling management? When you've got a major IT project, what I basically say is, no news is not necessarily good news. You've got to keep on top of it. Don't just assume that everything is working okay. You need technically knowledgeable insight to make sure things are being done. I'm a big believer in, you need to have some key metrics being reported to the senior decision makers. How do you know things are okay? How do you know things are not going off the rails? But I also say the KISS principle, keep it simple, stupid. You've got to keep that in mind. And if I look at things like, like e-health, for instance, I'm also quite involved in something, people from outside the province might not be aware of it, but we have an air ambulance service called Orange, which is getting a fair bit of attention. And we went in there and we started doing some, we selected it for an audit. It was an outside entity, and about 4 or 5 months after, maybe about 6 months after we were in there, the Star started getting a bunch of brown envelopes. But anyway, it's been a fairly hot political issue. The Standing Committee on Public Accounts has interviewed 60 witnesses. I think they've had 20 hearings. It's a major political issue. And again, when I look at things like Orange and e-health, relatively speaking, they were spending about $200 million a year on e-health. They're spending about $150 million a year on the air ambulance, but in a $40 billion health budget, it tends to not get a lot of attention. So again, I've sort of said to the deputy ministers of the major ministries, just don't pay attention to your jumbo programs, because the smaller programs can be on the front page just as easy as the jumbo programs. So finding the right oversight balance is important. One size does not fit all. As well, in the public sector, the minister's always going to be accountable. A good example is Orange, where basically it was an outside organization being funded by the ministry. They had an independent board of directors. They were federally incorporated. But at the end of the day, if there's a blow, when the opposition stands up, it's a minister of health that's going to have to stand up. And it doesn't matter if it's a hospital, if it's a long-term care home, it doesn't matter. It's going to be, and I've said this, it's going to be the minister that has to stand up. Because I've had this situation with land ambulances where they're run by municipalities. I said to the ministry, well, you might say, well, it's a municipal issue, but at the end of the day, if there's a problem with land ambulances, it's going to be the Minister of Health. It's going to be Deb Matthews, going to have to stand up in the House and answer to it, so you better pay attention to it. I've talked a little bit about being on the front page. I think if there's anything that I would say that you could recognize, it would be, what kind of a business model can we have that we can share risk with the government? And we have to recognize that they are, my sense would be, on these big major innovative projects, they're probably gun shy. They're concerned about the risk. They want to make sure it's cost effective. They may not have the in-house expertise to knowledgeably oversee it. So given that context, what kind of business model can we come up with that we can address those concerns, try to share risk, but by the same token, make sure that we're being fairly compensated, fairly treated, and fairly paid for if we're bringing in an innovative technological business strategy. So I would say if there's anything that you might want to put your minds to, it would be, what can we do in that area so we can go to the government and say, we think we have a solution for you. We recognize the situation that you're in. We recognize this stuff could be all over the paper. We recognize they're going to stand up in question period and beat you to death. We think we have a solution that might help you, that at least we can share the risk, that we've got a pretty significant sort of what I call skin in the game. The last thing I'd say too when you're doing your projects, and this kind of goes back to when I was up at York University, I always used to tell my students, I think I had a multiple choice question on it, what is a real fiasco in a major IT project? And my sense was it's not necessarily going over budget. It's not necessarily taking longer than it should. To me, a real failure is when your new IT project doesn't meet the needs of the users. And so, that's kind of like IT 101, but we still see that quite a bit where the users are not adequately consulted. And what I mean by the users, it's the people on the floor that bring up the screen when the member of the public calls and they bring up the new system. They can't answer the questions they want. Nobody asked me about what I need to deal with the customer. We see that in healthcare, social services, in justice. So I just throw that out to you. And I know you all keep that in mind, but is the system going to meet the needs of the users at the end of the day? So I think that's my last slide. And I think I have time for, do I have time for a question or two? Absolutely. Certainly. Oh, okay. So I'll be happy to take a question or two. We can go anywhere in the questions, like, McCarter, how much money do you make? Wherever you want to go.